Road carnage is the single most cause of admission to intensive care in Uganda. In 2018, road accidents alone claimed 3,000 lives, leaving more than 2,000 people nursing serious injuries. Sepsis, trauma and obstetric complications are also listed among the most common indications for intensive care unit admission and mortality in the country, according to the assessment on the current capacity of intensive care units in Uganda. The study was carried out in 12 hospitals with functional intensive care units in Uganda over a 2-month period between March and April 2018 by health experts from Makerere College of Health Sciences. It was established that in Uganda's National Referral Hospital, mortality is 3 to 4 times that in high-income countries, despite having a younger, physiologically robust and potentially more productive population, and that there were only 12 functional of 14 reviewed intensive care units in Uganda, with over 80% of them located in the capital city. The other two in Lira and Jinja General Referral Hospitals were non-functional due to lack of human resource. The country has 55 functional ICU beds. This translates to less than 2 beds per 1 million people. Intensive care units had variable nurse-to-patient ratios, with the worst at 1 nurse per 8 patients. Early this month, Ministry of Health officials said in a press conference that they are working towards improving the state of ICU in the country.
It's not an easy venture. It's quite expensive because to establish an intensive care unit, it needs a lot. But as ministry, that is the direction in which we are moving. We want to establish intensive care unit in all the regional referral hospital. We have already started with the ones of intensive care unit for pediatric and also adult in some of the regional referral hospitals.
The head of the casualty department at Mulago Hospital, Dr. Alex Banjirana, says they are overwhelmed by the numbers of patients that require critical care.
In a month, we receive about 1,600 to 1,800 patients visiting the unit. And of these, about 1,000 to 1,200 are admitted. And of these, 30 to 40% are as a result of road traffic crash.
However, it was established that there has been improvement from makeshift structures to more established ICUs.
But it's not a cheap venture, but still that is the direction we want to follow. You need to train people in that area. You need to invest in equipment. You need to invest in quite a number of items.
Numerous limitations to operating intensive care units, such as few intensive care trained staff, poorly maintained equipment, and high cost of care still exist.
For example, one bed, you may not have it just like any other ward. To have a bed, intensive care unit, it's not like having one nurse to run hundreds or tens of patients. You may have 2 nurses for 1 patient on that bed. Even the doctors. So it's not cheap.
There are 2 emergency medical specialist training programs for doctors that have started at Mbara University and Makerere University. There's also one for nurses in critical care and emergency care at Mbara University. And there's also one being developed at Makerere University. So this will be like the highest level of specialists in emergency medical services.
It is therefore imperative to describe the ICU capacity in low-income countries to identify the need for provision of high-quality care at the lowest possible cost of the disease burden.
In the refurbished hospital, they have catered for more beds for the general patients. I can't specifically say the number, but I think it's about 20. And they have, in that ICU, they have 2 levels. There's the level 1 and the level 2. For the level 1 are for those who are really critically ill. The level 2 is for those who are recovering. And I think those are about 40 beds. In the women's hospital, they have 17 beds. And in the new hospital, they have also catered for, there's specifically pediatric ICU. And there are also ICU beds in the transplant unit.
Pricing for ICU services stands at 200,000 shillings averagely in government hospitals and can go as high as 2.5 million in private hospitals per day. Walter Mwesije, NTV.